Dave is 66, still working, and still putting money into his health savings account every single paycheck. And he has no idea he's about to owe the IRS a penalty he never saw coming. Because of one quiet Medicare rule, the day he finally signs up, his coverage can reach backward up to 6 months, and any HSA money he tucked away in those months suddenly counts as too much. Today, in plain English, why you have to stop your health savings account contributions before Medicare starts, and exactly when to hit the brakes so the penalty never touches you. No scare story, just the map and the fix. Here's the heart of it, and it's smaller than it sounds. There's a rule that you cannot put new money into an HSA once you're on Medicare. Not shouldn't, can't. The account itself is fine. The trap is hidden in the timing, not the rule. So let's walk it slowly, one piece at a time, and by the end, you'll know the single date that matters. First, the part almost nobody is told. When you sign up for Medicare Part A after 65, or when you claim Social Security, your Part A coverage doesn't just start the day you ask. It reaches backward. Medicare.gov says it plainly. Your Part A coverage starts 6 months back from when you sign up to half a year, backdated, automatically. It can't reach earlier than the month you turn 65, but for someone who worked past 65, that's a full 6 months of retroactive coverage landing in your lap the day you enroll. You didn't pick that start date. The rule did. Now, why does Part A do that at all? It's actually meant to be a favor. It makes sure you're not left with a gap in hospital coverage while your paperwork catches up. For most people, it's harmless. But if you've got an HSA, that backward reach is exactly the thing that turns helpful into expensive. So hold that picture, a start date that quietly slides 6 months into the past. Here's where it bites. To put money into an HSA, you have to be covered only by a high-deductible health plan, no other insurance, including Medicare. That's the whole deal an HSA is built on. So the moment that backdated Part A coverage settles onto those past months, the calendar now says you were on Medicare during them. And every HSA contribution you made in that window, it's instantly reclassified as an excess contribution. Money the rules say shouldn't have gone in. You were eligible when you made it. The backdating makes you ineligible after the fact. So what does an excess contribution actually cost? This is the number to hold on to. The IRS charges a 6% excise tax on excess HSA contributions. And here's the sting. It's 6% for every year that extra money just sits in the account uncorrected. Not a one-time slap. A tax that can come back year after year until you clean it up. That's the entire trap, start to finish. A backdated date you didn't choose, turning honest, good faith savings into a recurring penalty. Let's put Dave back in it so you can actually see the shape of it. He turns 66 in June and keeps contributing to his HSA all year, the way he always has, a little out of every paycheck. In December, he finally files for Medicare and Social Security. Part A backdates 6 months, all the way back to June. And suddenly, every dollar he put in from June through December is sitting there as excess. He didn't break a rule on purpose. He never got greedy. He just never heard about the 6-month look-back. That's the part that gets people. It isn't carelessness. It's a blind spot nobody warned them about. Now the good news, and this is the whole reason to keep watching. The fix is simple, and it is entirely in your control. Stop your HSA contributions about 6 months before you enroll in Medicare or claim Social Security. 6 months ahead, because that's exactly how far back Part A can reach. If you stop early enough, the backdating has nothing left to grab. No overlap, no excess, no 6%. The trap only closes on you if money is still going in during those final months, so you simply make sure it isn't. So what's the one concrete thing to do? If you have any idea when you'll go on Medicare or start Social Security, count back 6 months on the calendar and tell your payroll department or your HSA provider to turn the contributions off by that date. That's the whole action. One phone call or one box unchecked online, and the trap closes harmless. If your timing is fuzzy, lean earlier. Stopping a little too soon costs you nothing, But stopping too late is the part that costs 6%. Here's the piece that makes all of this much easier to swallow. Stopping contributions does not mean the money is stuck, frozen, or wasted. You can still spend every dollar in that HSA, completely tax-free, on real Medicare costs. Medicare Interactive notes you can use HSA funds to pay your Part B premiums, your Part D drug premiums, your deductibles, your copays, all of it with no tax, as long as it's a qualified medical expense. So you're not losing the account at all. You're just flipping it from filling up to paying out. For a lot of people, that HSA quietly becomes one of the best ways to cover Medicare bills in retirement. And to be fair, there's a real nuance if you're still working past 65 with solid coverage from a current employer. Some people in that exact spot legally delay Medicare and keep contributing to their HSA for a while longer. That can be perfectly fine, and it's a genuine option. But the day you do decide to enroll, or the day you claim Social Security, that 6-month look-back is sitting there waiting. So that's the moment your 6 months early countdown has to begin. When in doubt, stop early. The rule doesn't punish you for being cautious. So I'm curious, are you or someone you love still contributing to an HSA somewhere near that 65 line? Drop it in the comments because this is the exact rule that quietly catches the most people, and the question you ask might be the one that saves somebody else the penalty. I read every single reply. If this gave you one clear thing to act on, go ahead and subscribe. Next, we're covering the Part B late enrollment penalty that can follow you for the rest of your life. This is general information. It is not advice, and it is not tax advice, and we are not affiliated with Medicare. Rules and numbers change, so for your own situation, check directly with Medicare, the IRS, or a trusted tax professional. I'm really glad you're here. I'll see you in the next one.